Frank, are you ready for your bath today?
I don't need a bath.
Oh.
I had one already.
Oh, did you?
Yeah, I don't need a bath.
Well, how about a shampoo? I have two kinds. You can choose which bottle you'd like.
No, I don't need it.
What are the ABCs here? The B, behavior, is Frank's refusing to take a bath.
I don't need a bath.
Oh.
I had one already.
Oh, did you?
Yeah, I don't need a bath.
He is really quite sure he doesn't need one. A is the caregiver announcing bath time.
Frank, are you ready for your bath today?
The caregiver's announcement of bath time triggers Frank's refusal. The C is the caregiver persisting.
Oh, did you?
Yeah, I don't need a bath.
Well, how about a shampoo? I have two kinds. You can choose which bottle you'd like.
No, I don't.
The caregiver attempts to get Frank to choose a shampoo color to distract him from his refusal. This is a good idea that might work sometimes, but it didn't work here. Bathing patients is often very difficult. Many of them refuse to bathe and put up quite a struggle over it. As in all situations, the antecedent, the announcement of bath time, and the consequence, the caregiver persisting, are both important clues necessary in changing the patient's behavior. The focus here is on both the A and C to find ways to talk Frank into taking his bath with a minimum of agitation and frustration. Let's go back to the scene and do things a little differently.
Just put this on your hand. Oh. What does that feel like? What did that feel like, Frank? Does that feel all right?
Yes,
That feels okay?
Yes, sir.
Let's take off your pajama tops so we don't get those wet. You want to keep your pajama tops dry, don't you?
Okay. Okay.
There we go. Keep you dry. Now this time, let's take the shower around. You tell me how it feels. How is that? That's all right?
That's all right.
All right. Are you feeling better? How's that?
Okay.
Did I tell you about the squirrel in my yard?
Squirrel?
Remember the squirrel? The squirrel comes into my yard and stands at my front door.
Oh.
Remember when I told you about that?
What were the ABCs here? Notice how by changing the antecedent, the behavior changed. The B, behavior, here is Frank's cooperation with the bath, something we really missed earlier. The A, antecedent, was the caregivers introducing the water slowly, step by step. The C, consequence, is the caregiver being able to bathe Frank calmly. But notice, she's not taking any chances and continues to distract him by talking and telling stories. The caregiver treated the patient with dignity, proceeded step by step, and was eventually successful in her goal of giving a bath. Her strategy included the following. Note how each of these affects the antecedents. The caregiver took her time and didn't rush the patient, using a soft, reassuring voice tone and identifying which body parts will be next as the bath progressed. Giving specific verbal instructions, one at a time. Giving the patient choices whenever possible. At the same time, the caregiver avoided argument and confrontation. Using a gentle touch to to different parts of the patient's body to reassure him and soothe him. The caregiver used a good shower technique. This included using a trickle of water from a handheld shower hose. This is not as frightening as exposing the patient to a lot of water at once. Allowing the patient to touch the water and become accustomed to it. Gradually undressing the patient so that he could be bathed in a very gradual fashion. Keeping him covered until it was time to bathe the particular body part. Not using the shower on the face, which often produces a response of fright for many patients, and saving face washing and shampooing until the last. Frank cooperated with the caregiver this time, but what if he hadn't? Sometimes nothing you try will work, and you have to try again later, or have someone else try again later. If you persist too long and hard when the patient is refusing, the result could be more distressful for both of you. By observing behavior and using the ABCs, you can make an impact on troubling behaviors found in patients with dementia. Use the sample behaviors from these tapes to practice and become confident with the techniques presented here. Dressing a patient can be a difficult task. Often, patients are resistant to changing clothes or being helped to change their clothes. In the following scene, a caregiver tries to get a patient to change into a clean sweater.
We're going for a walk now. Let's put on this sweater. No, that's the wrong arm, Esther. This way. No.
What were the ABCs here? The B, behavior, was the patient struggling with the caregiver. The A, antecedent, was the caregiver attempting to put the sweater on the patient. The C, consequence, is the frustration and upset of both the patient and the caregiver. Let's look at this scene again and watch it resolved in a more successful way. By affecting the A, antecedent, and preventing the patient from becoming upset, it is possible to get the sweater changed. Notice how the caregiver approaches the patient slowly and calmly, thereby changing the A, antecedent.
Let's put on this nice sweater. Now here, we'll put this arm in first. That's right. That's right. There we go. And then this arm, okay? Right in through here. Good. That's it. That's it, Esther.
What were the ABCs of this situation? The B, behavior, was the patient cooperating with the caregiver. The A, antecedent, was the caregiver approaching with the sweater and calmly proceeding to put it on the patient, slowly, step by step. She went the patient's speed, which is often much slower than the caregiver's slowest speed. The C, consequence, was the caregiver successfully putting the sweater on the patient. Notice the reinforcing and encouraging statements the caregiver made throughout the process of putting on the sweater. She kept encouraging and talking with the patient.
We'll put this arm in first. That's right. That's right. There we go. And then,
by working with the A, antecedent, the caregiver was successful in avoiding conflict and not upsetting the patient. Therefore, she was able to get the sweater on the patient and no one was upset. In the tapes that follow, we will show you other difficult behaviors and how these behaviors can be observed, broken down into ABCs, and changed.